Hello everyone, it is Princess_Mini4 and welcome back to my channel. In today's video, this is going to be my surgery video and my recovery video. If you guys are new here, please make sure you hit that notification bell and hit that subscribe button so you never miss a post. Alright you guys, so today's date is Thursday, June 5th, 2025 and it is 6:24 a.m. Today I am having my diagnostic laparoscopy. If you've been watching me for a long time, I've always complained about how bad my period is. So they are going in, they're going to do like 3 or 4 incisions in my stomach, kind of like with my weight loss surgery. And they're going to go in with a camera and they're just going to check out all my reproductive system to see if there is any endometriosis. I went through a lot yesterday just to have this surgery. And literally they were calling me at like 5:30 saying, okay, you're cleared for surgery. I'm like, thank the Lord. Like, it was so last minute. And based off the people I've seen off of YouTube and other people, or even just reading like medical journals, everybody else has prep, but I have no prep for this surgery. All right, y'all, it's so hard to talk in the morning because my grandma's always blowing her nose. But I have no prep for this surgery. I wasn't told to take any laxatives. I wasn't told to take any Miralax, no Ensure, nothing. And I've seen other people having to wash with this stuff, nothing. She said, show up. So I'm like, okay, I don't understand the difference, but there's no prep. It's really weird. All I was told is just to not eat and drink after midnight, which I drank a lot of water this morning. They say you can drink water up to 2 hours before your surgery, so I'm supposed to be there at 7:30. So I stopped drinking water at 5:30 and I drank, you know how my water bottle says 8 a.m., 10 a.m., 12 p.m.? I drank all the way to 12 p.m. because I want my veins to be hydrated and I don't want them to get out of this hand because I just had an IV contrast there for a MRI and this is still painful. So yeah, we're gonna be leaving here in about 20-ish minutes. I'm finishing up reading my Bible. I got up, got all ready, took a shower. I'm not allowed to put on any lotion. They said no deodorant, but I did put on like one swipe because I need deodorant. I can't live without it. I'll go there and they'll think I ain't shower at all because I stink. So I just sweat a lot, and then when I sweat, I smell bad. So I'm gonna be a little bit anxious because it's a surgery. And I'm actually mostly anxious that they're going to go in there and not find anything. Then I'm going to be back at square one. Like, I'm telling y'all, I'm going to say within the next 5 years, if I don't conceive at least one time, I'm getting rid of my uterus because it's just not worth it. You know what I'm saying? Especially if they don't find anything. So I would just try to take you guys along with me for at least a week to see kind of how the recovery is, maybe less if it's not as bad. I don't even know how that's going to be. She literally said it may take up to 2 weeks to recover, but she didn't say where I should sleep, what I should eat, what I should drink, nothing. Like, it's kind of weird because I've been sleeping in my room for the last 5 days. And my bed is, y'all see, it's a futon. It's like a foot off the ground. I don't know if I'm gonna be able to get down that low. I don't know anything. So hopefully I get some kind of information. It's kind of weird. Like, this is the weirdest surgery, I think, and I've had a million of them. And it's just kind of like there's no prep, there's no information. All they said is you could take this pill, but don't take this pill, don't drink herbal teas, blah, blah, blah. But it's like there's nothing really. So yeah, I will see you guys. I may do an outfit of the day, probably not though. I'm just gonna be wearing sweats, even though it's gonna be 90 degrees out today. But I want to wear something comfortable because I know they're gonna like put air in your stomach so they can see, kind of like my weight loss surgery. So I'm gonna be in a lot of pain. So yeah, but I will just probably see you guys when I get to the hospital. All right, you guys, so it is 6:47. We walking out pretty much right now, but I'm bringing my emotional support, Mario. Just wanted to let you guys know. Talk to my camera. Okay, you guys, so it's 8 o'clock and I have my IV. Can't see it. Because there's no veins in my other hand. What are our veins if they're not there?
No. So the one that you got before with the palm, they had to put it in that same one?
Not the same vein, just the same hand.
Right, that's
yeah.
what I'm saying.
So, I got it over here, y'all. So I'm hooked up to the saline stuff. And I got all undressed and I had to take a pregnancy test. And I'm not pregnant, unfortunately. But I am, yeah, that's your phone. But I am all dressed. Well, undressed, I
All
guess.
dressed up.
And I got the little patch back there for nausea. And yeah, so I guess the next clip I will probably be waking up from surgery. So yeah, bye guys.
They never say.
Alright you guys, so it is 12:55. I am finally home. I don't know how long I was actually under, but I ain't gonna talk for long because I do want to take a little nap or something. Probably just rest. I don't know if I'm gonna go back to sleep, but I don't know if y'all hear my you know those things I got from my legs. Yeah, I just don't want no blood clots, no issues. So, but yeah, they took me down not too long after I filmed that video. And yeah, I went in the room and I was trying to stay awake for a long time. I don't remember falling asleep, but I remember waking up. And I kept waking up and then falling asleep, waking up, falling asleep. Like that happened for like 10, 15 times. Like I would wake up and look around. Like it was crazy. Like that anesthesia is no joke. Like, but there wasn't that many people in the recovery room because there was this lady who came in after me and I felt bad for her. I think it was like her first time under anesthesia, so she was going through it. But I don't remember if I was crying and carrying on, but it affects everybody differently. I got this little sore on my lip. You know they put that tube in, which I don't care. They be like, is it okay to put a breathing tube in? I'm like, yes, I need to breathe. Like, don't ask me a question like that. Like, put the tube in. Yeah, like, because y'all don't breathe. You don't breathe under anesthesia by yourself. So I'm like, put the tube in. So, but yeah. But I am back. So far, I'm just tired. I was kind of like shaky on my feet. But other than that, I mean, I feel like I did pretty good. I had me some Lorna Doones. And I got a Shasta. You know, they said, do I want a Pepsi? I was surprised they carry Pepsi.
That's my favorite. Usually I just have cranberry.
Oh, I ain't want no cranberry juice. And I kind of, like, I was eating the cookies. I'm like, man, I should have had milk. I had Lorna Doones and the Shasta. The ginger ale. So, I drank all that. Then I had, Lorna Doone cookies. So, that was what I ate. But I'm going to lay here for a little bit. Then I will eat something else. Because I ain't ate since, like, 9 o'clock last night. So, but I just wanted to rest a little bit and then probably use the bathroom. Oh, so they gave me like postpartum underwear. I think that's kind of funny. But I'll tell you about like the results and all like the post op care later because I'm tired. But yeah, just stay tuned. Alright you guys, so check my watch. It is 5:32. My grandma just left to go get the mail, so I want to quickly read to you guys my little discharge thing. So keep your incisions clean and dry. Do not scrub off the adhesive. Today, go home and rest and diet as tolerated. But then it also says down somewhere else to not eat spicy or greasy food. So which one is it? I don't know. You may shower, but no tub bath, swimming, intercourse, tampons, douching, or anything in the vagina. Do not lift more than 10 pounds until instructed. So I guess that's going to be for my post-op, which is on the 23rd. So that's going to be a little while. No exercising for 1 week. You may go up and down the stairs as you feel comfortable. Do not drive for 2 days. Take Tylenol, and I just took me a dose. So if I'm up, I'll have me another dose around like 11:30, 11:45 tonight. You may have vaginal spotting, which I do, and I can't even really say it's spotting. They gave me these postpartum underwear. I feel like a pregnant woman. They gave me this postpartum underwear. I'm looking at my scissors. I'll show y'all in a second. And when I was sitting there, he said, all right, put this pad on. I won't look. I was cracking up. He turned around and went on the computer. He was so nice, the recovery nurse, because I had woke up and I was like, man, what time is it? He said, it's 11:30. I said, oh, wow. Yeah. What am I talking about? Like, I just woke up acting like I was at work or something. But I'm definitely bleeding, but you'll see why when I get down there. Call the office if you have a fever, pain, heavy bleeding, blah, blah. more than a pad an hour. Well, right now I'm wearing my period undies, so I received 975 milligrams of Tylenol at 7:45 a.m. So I just took 2 doses, which is 1,000, so that brings me up to 1,975. You can have up to 4,000, so I'm good on that. Then they gave me Toradol, which is an ibuprofen, through my IV. And I'm like, and she's like, well, if you want to take it again, don't take it till 4:30. I'm like, I ain't supposed to take that anyway. So hopefully that doesn't mess with nothing. I don't know. Then the rest of it is talking about this patch. Don't touch it. If you touch it, wash your hands. Try to keep it on for at least 24 hours. You're going to have dryness of the mouth, which I do. Drowsiness, which I cannot stay up. I took like 15 naps since I've been home. I definitely had temporary blurring of vision. That's it though. So that is my discharge papers. My hands are super duper shaky right now, so I'm not really sure what's up with that, but I want to read this quickly before she gets back. Yeah, so my post-op is June 23rd, so I'm gonna, all right, so I printed this off of my chart. My pre-operative diagnosis was chronic pelvic pain. My post-op diagnosis was same and endometriosis. Thank you, Jesus, that they found endometriosis. I don't want to have endometriosis. I never wanted to have it, but I almost wanted to have something, so there was a reason why I was in so much pain every single month, all throughout the month. You know, I wanted there to be something. Ain't that weird? Like, you never want to have anything bad, but you want there to be something, so there's no, like, because doctors be thinking you crazy. How long have I been trying to get this surgery, y'all? At least 2-3 years. 2-3 years I've been wanting to get this surgery, and I finally got it, and they found endometriosis. Thank you, Jesus. Right now my throat hurts. Let me take one of these little lozenges. Actually, it's a dry mouth one, so that should help with my mouth being dry. Alright, that's my anesthesia, blah blah. They burned off a few things. My grandma said when they called her, they burned off 2 of them, but you know. The findings were stage 2 endometriosis, right fimbriated end of tube adherent to right cul-de-sac. I don't know what that means. Right fimbriated end of tube likely clubbed in appearance, but once adhesions released with more finger-like. Filmy adhesions from the adnexa, ADNEXA, to the post cul-de-sac on left. Okay, it's hurting. That's why I had to take a pain pill. Multiple perineal implants noted in the posterior peritoneum. Endometrial implants over left uteral ovarian ligament. Chromopertubation confirmed in both tubes patent. Normal appearing liver and gallbladder. There's so much in here, y'all. What in the world? This has everything too. The patient was taken to the operating room with her IVs fluids running. That has literally everything. I'm just trying to see, where does it say she burned it? And apparently they put a thing on my belly button, but they weren't able to use it. It says the position was not confirmed. Although pressures were appropriate and placement seemed appropriate with a saline drop test, upon placement with a 5mm trocar, the position was not confirmed. So they didn't use my belly button. They ended up making 2 other incisions. So I'm not sure what happened to my belly button. It is not a different belly button, but it's different, you know, because of my whatchamacallit, tummy tuck. They put CO2 gas in there. They saw my normal upper abdomen, bladder, and gallbladder. The anterior cul-de-sac was normal. There were scattered endometrial implants noted in the posterior cul-de-sac below the uterosacrals. Both ovaries were normal in appearance. However, the left ovary had endometrial implants over the uteroovarian ligament. There were filmy adhesions in the posterior cul-de-sac. Using endo shears, the filmy adhesions were easily taken down. There were a couple of isolated perineal cysts that were excised and sent as specimen. And that's pretty much it, y'all. So yeah, that is my diagnosis. Endometriosis stage 2. And I guess I'll talk to her when I get to my appointment. Alright, you guys. So I just ate and now I'm having like the really bad gas in my shoulder. But I do want to see if I can show you guys my incisions. I ain't got no bra, y'all, so there's one here, and one here. So I'm wearing my period panties, y'all, okay? I'm still spotting, but it's really hard. They don't hurt too bad, but you know. So that's how they looking. Yeah, I'm just having this pain in the shoulder, the gas pain. Cause I just ate these pancake to-goes things for dinner. Well, literally just 2 pancake to-goes, which are those bakery things. You just either eat them or pop them in the microwave. We pop them in the microwave because they mold when they sit outside because it's so hot in here. We're literally trying to cool the house down. It's 86 degrees inside this house. Insane. I'm up walking around trying to help the gas. I honestly feel really good for the most part, which is like kind of strange. Other than the gas and a little bit of pain when I like breathe in and stuff. Or cough. I haven't coughed yet, but burping and sneezing probably sucks. Well, burping sucks. I know coughing and sneezing probably sucks too. But I'm just gonna go back and sit down and rest, y'all. What else I was gonna say? Yeah, I think just eating those pancakes just brought some of the gas out. But yeah, starting to feel a little tired, so I'm gonna go ahead and sit right back down. But I was actually able to walk pretty good, so I'm kind of happy about that. But yeah, I'll catch you guys up later on. Alright, you guys, so it is 12:18 p.m. Well, 12:18 a.m. I'm getting ready to head off to bed. The pain is not too bad when it comes to like my surgery wise. That's not too bad. It's like, I think I'm more so stiff. Like when I first get up, I can't stand up all the way straight. But now I'm just having the really, really bad gas pains. Like this shoulder, in the middle, it's everywhere. And when I went to go bend down, because I brought these in here for my feet, for my legs. So I'm still sleeping in my room. Hopefully I get comfortable enough. But I went to go bend down to plug it in on that thing over there. Don't mind my bra. On the surge protector. When I tell you I bent down, my lower back, all on my right side and the right shoulder, 10 out of 10 for gas pain. The gas pain hurts worse than the surgery. That doesn't even make any sense. But I'm gonna try to get some sleep. I took me a pain pill at like 11:35. I still got that on. So I will definitely talk to you guys either in the middle of the night or in the morning. I just hope and pray that I can get some sleep and that I start to feel a little bit better. And my throat is still killing me. And I've taken at least 2 of these little lozenges thing. I got 7 more of them. So we'll see. Hopefully tomorrow. I may just get up tomorrow and make me some tea and see if that helps. But yeah, this is painful. Also, sorry for this weird angle. I'm laying in the bed. Another thing I forgot to mention, they put a catheter in me during the surgery. So now every time I pee, it burns like really bad. It's getting better though. And honestly, laying here is making this gas pain so bad. Oh, and we have no gas X or nothing. So, I might not get sleep tonight. And look at my face. Look at all these scars. Where'd they come from? I'm in so much pain. I don't know what to do, y'all. I'm in so much pain. My arm is hurting so bad. My arm and my back. And then also when I'm sitting here, I can feel like I don't know if my uterus and my organs are trying to get back to, I guess because they moved them out the way. That's painful too. I don't know what to do, y'all, but I'm in so much pain right now. Alright, you guys, so I just woke up. I'm sure you can tell. It is 9:25 a.m. That's healing. My mouth is dry from this, so don't mind me. I slept pretty okay. When I get into the living room, I will show you what my ring says in my Apple Watch to see how much I actually slept overnight. And I only went to the bathroom one time, so I'm happy about that. But no matter how you have this bed situated, it's still low, especially trying to sit up. But then again, I remember when I had my weight loss surgery and I was sleeping in the bed with my grandma, it was the same way. You just can't get up. It's crazy. But I'm sitting up now. I don't know if I'm gonna be able to make this bed because every time I bend down, I get the gas pain. Oh, and they actually just called me, the surgeon, not the surgeon herself, but somebody at the surgery center. And she said when it comes to gas, just try to lay on your side or like sleep in a reclining chair. So we'll see what happens tonight. But yeah, that's a little update. I will talk to you guys when something else happens. Alright, you guys, so it is 12:13. I was out there reading my Bible. I didn't even get to finish reading my Bible when my grandma texted me and said, how are you feeling? I'm like, I'm sleepy, my arms hurt, whatever. She's like, come get in the bed with me. I'm like, so I sat here for a while just wasting the day away because now it's 12 o'clock and I haven't eaten breakfast yet. So there's no way I can eat breakfast at 12:30 and have lunch at 2. Like, that's not smart. So I don't know what I should do. Just maybe not eat till lunchtime. I don't know. I know you're supposed to eat with pills, but oh well. Then I can do it better now. I just don't like laying in bed. Even though when I'm sick, I just don't like laying in bed because like I got stuff I need to do. But right now I'm just really sore. Like I said, I keep on touching that patch. I gotta go wash my hands. But yeah, that's what I'm gonna go do. Maybe get a breakfast. I don't know. But yeah, I'm about to get up. All right, you guys. So it is 3:10 p.m. I can't clear my throat because my stomach hurts. All right, so I took a shower at around like 2-ish, and it actually wasn't that bad of a shower. I didn't get lightheaded or anything, and I obviously didn't like scrub the incisions. But yeah, I didn't get dizzy or anything, and now I feel nice and clean. But I'm surprised I didn't fall off. It definitely got wet. But yeah, my face is a mess. I don't know, and look how greasy my face is, y'all. I did not put grease on my face at all today. I think my face is just naturally greasy. I don't know why. We're getting ready to head out, run a few errands. I think it would be good anyway so I can get some walking in because they said that's what helps with the gas because it's still there. So that's going to be nice to get some walking in. Then, yeah, I'm still spotting just a little bit, but now it's just like the brown, but it's really, really light now. But I am getting like almost kind of period cramps, but I think my period is due next week, so I also don't know if I'm getting period cramps from the surgery yesterday or because my upcoming period. I don't really know. But yeah, I'll probably just update you guys when I get back home, just y'all can see how it went. Because honestly, I ain't gonna lie to y'all. Let me knock on some wood. I don't feel bad. Like, other than the gas pain, I don't feel bad at all. So it's like, you know, kind of crazy. But I'm due for my next pill, I think 4:30. So I will bring that with me. And that's another reason why I need to go to the store because I'm running out of Tylenol. Y'all know I can only take that. So I need that for my period as well. So yeah, that's pretty much the update, and I will talk to you guys when I get back home. Alright, you guys, so it is 12:12 a.m. I'm in my bedroom again. I'm going to try to sleep in here tonight. When the lady called me yesterday and I was telling her about how bad the gas pain is, she said to not lay flat, but to lay on your sides. So when I was laying in my grandma's bed earlier, I was actually able to lay on my side comfortably. So if I can't get comfortable, I might just have to go in her room. Because at the end of the day, it's still a futon, and they're not really meant for long-term sleeping, and they're not really meant for definitely recovery, because it's not comfortable, you know. But yeah, I'm gonna try to sleep in here again. Right now, it's just this arm is just so bad. And when it comes to everything else, I'm fine. Like, I took 2 doses of Gas X today, you know, so maybe that's still gonna kick in, I don't know. Because when it comes to my incisions, they don't hurt that much. It's just like, they're like tender. And then it's like when you get up after sitting for a long time, then you're stiff. But other than that, they're not the issue. The whole issue is literally the gas pain. So, which is crazy. But I'm gonna try to get some sleep. Hopefully I can lay on my side. But if not, like I said, I'll just end up in my grandma's room. What else? Yeah, I think I've stopped spotting altogether. And I was gonna say something else, I forgot. Yeah, I don't know. But I will see you guys. Oh yeah, I'm not wearing my little leg things because I just don't feel like it today. I've been wearing them all day. And it's just like, it also makes me hot. And it also makes it hard for me to move in the middle of the night. And I don't think they're really gonna work if I have both my legs on top of each other. So I was like, as soon as I get up tomorrow morning and do my little morning routine, I'll put them right back on. Because I've been doing, especially since we went out today, and I was fine walking. It's just when I first get out the car, I'm stiff. So I'm walking like bent over like that. But the longer I go, I end up standing all the way straight. It's just when you first get up, you're stiff. So, but we walked around a few stores, got a Slurpee, went inside a Walmart, and I was fine. So, you know, when it comes to that part, it's not that bad. It's just the gas that's insane. Because if I was in the refrigerator trying to make me black milk tea yesterday, just for me to reach with this arm to grab the milk, the gas pain from my butt went all the way up to my shoulder. When I tell y'all, worst pain I've ever felt. Worst pain. Well, it's up there with my period cramps. But yeah, I will talk to you guys probably in the morning. Alright, you guys, so it is the next day. It's Saturday, June 7th, 10:29 a.m. I took that thing off last night because it was getting on my nerves, and now it's like hurting where it was, so I don't really care for that. But I slept in my bedroom till about 4:30-ish. I got up and went to the bathroom, and I just could not get comfortable. So then I just said, all right. So I got up and I went and I slept in bed with my grandma, and I was able to sleep on both sides. And this gas is no joke, y'all, because I'm telling you, like, every time I would turn to go, like, I wish I was lying. Like, you could hear the gas coming from my stomach, just moving up, and you could feel it too, obviously. So that's crazy. So I took me a pain pill at 10, well, 2 Tylenol at 10 a.m. Also, I took me a stool softener because I have not been able to use the bathroom, but this happens every surgery, for me anyway, because, you know, you're afraid to strain. Because one time the doctor said, oh, your intestines may come through if you strain while you use the bathroom. And I'm like, oh, great. So now I'm afraid to use the bathroom. But I got up and got myself all ready. I got me washed up and everything. And yeah, so I'm about to sit down and read my Bible, then make me some breakfast. And now my throat is hurting bad again. I don't know what's up with that. That's kind of weird. But, you know, yeah, I don't think we're going anywhere today. It's supposed to rain. And I don't know if I'm going to church tomorrow or not, because my grandma already said, you can barely walk. Why would you go to church? And I'm like, I went to Walmart. Now, if I could walk around Walmart, I can walk around church. At least that's how I feel like, you know. The only thing I'm worried about church is obviously driving there. Then when he starts preaching and stuff, then he's like, stand up, sit down, stand up, sit down. That's going to be hard for me. But I don't always have to stand up because the older people, some people just don't stand up at all. So if they want to question me, I can say, look, I just had surgery. So, but we'll just play that by ear, see how I'm feeling when it's time to trade cars later on. But yeah, I just wanted to give y'all a little update. I got to use a step stool to get into my grandma's bed because her bed is so high up. And yeah, it's pretty painful still to like move. And even when, like, you know, I'm laying on my, not fully laying on my stomach, but when I'm laying on my side, it's not too bad. But yeah, this one still hurts. But I don't know what I'm gonna do tonight. I don't know if I'm just gonna automatically go sleep in my grandma's bed. And then I feel bad because now she has to make her bed and then she has to make my bed. So I feel bad because I can't reach my bed. It's too low. But yeah, y'all, I'm just gonna go ahead and read my Bibles and try to get me something to eat. And yeah, I'll pretty much update y'all. Hopefully I use the bathroom today, and hopefully this gas goes away, but we'll just have to wait and see. Alright, you guys, so it is 12:03. I'm getting ready to head to bed. I'm gonna be sleeping in here. Hopefully I'm able to sleep. I think I'm gonna go grab my AirPods just in case she wants to put on something I'm interested in. So I'll just put my AirPods in and listen to some worship music or something. But today was not really a good day. Like, the gas pain was just horrible all day today. And then today is just kind of like my incisions started hurting, and I'm starting to have like a harder time walking, getting up, and just feeling like dizzy, lightheaded. So I didn't even shower like I usually do every Saturday night, because I don't think I could have lasted that long in the shower. Like, I definitely would have like fainted or something. So this wasn't really a good day. Then I was like just not really feeling good, and now my nose start running. I don't know if I'm getting sick or that has something to do with it. Like, look at my nose all day. I don't know. And it's just like, you know, you just feel off, but you don't know how to explain it to people, but you just feel off. Like, today was just not a good day. So I'm hoping, I'm obviously not going to church today because I can barely just stand here. So hopefully I can get some more sleep tonight. Maybe I'll wake up and the gas pains will be gone. But I'll probably just be staying home tomorrow. Maybe I overdid it on Friday when I went out. But I felt good. And then it's like I felt complete opposite today. So yeah, it is what it is. It's all part of the recovery process. And then I went over my notes again, and I just realized that they also had to remove either 1 or 2 cysts. So that could be why things are taking a little bit longer. I'm still spotting, not as bad. But they also just didn't just remove endometriosis. They also had to remove some cysts as well. So I don't know why I expect to just jump up and feel okay. But yeah, I will update you guys tomorrow. Good morning, y'all. It's the next day. Sunday, June 8th. I'm just not feeling good at all, y'all. Like, I don't know. I feel like I can barely breathe. I just don't feel well. Didn't get much sleep at all. My throat is dry, and then I just keep coughing, and then it's like my throat is killing me. So I'm sitting on this chair. I don't know if y'all can see it, because I don't even have the energy to brush my teeth, yo. Like, I don't know what's going on. Like, when I breathe in, it's just so much pain. I don't know. And I can't take a cold pill because cold pills have Tylenol in it, and they don't have the same amount for pain. I don't know what to do. I don't even know if I told y'all, but I got a rash under my breast. It's just too much going on. So I'm gonna try to brush my teeth sitting here, and then maybe catch the church service. I don't know. I just don't feel well. All right, you guys, so we are on the road. I'm craving a Slurpee, so I'm gonna go get that. Oh, you see, I can barely breathe. I don't know what's up with that, but yeah, the gas pain's pretty bad as usual, but it'll be nice to get a little bit of walking in and to get a little sweet treat, a little bit of a little Slurpee, because I sat in the house all day yesterday and all day, well, pretty much all day today. And I was a little emotional earlier because I wasn't able to go to church, but I'll live. But this pimple's crazy. But yeah, my nose is stuffed up. So tonight I did the calculations. I took a dose of 2 Tylenols at 10 a.m. Oh Lord. I took a dose of Tylenol at 10 a.m. 2 of them. Then I'm going to take another one around 4-ish, because that'll be 6 hours. Then right before I go to bed tonight, I'm going to take my NyQuil, because, yeah. So hopefully I can wake up feeling a little bit better, no more headaches, congestion, nose running. So yeah, so you can do the math like that, because you can't exceed more than 4,000. So it's 1,000 for 2, so that's 2,000. Then it's like 650 with the NyQuil, so I'm able to take that, and hopefully it works on the pain as well. But yeah, I will pretty much talk to you guys probably tonight. Oh yeah, also I think I'm gonna come home later on tonight, maybe around like 7-ish, and attempt a shower. I just want to shower. Like, I didn't shower yesterday. So I do want to shower tonight. I'm not gonna be able to wash my hair, because I don't think I can stand for that long, because right now it takes me about 30 minutes to shower, wash, and grease my hair. I don't think I can stand up for 30 minutes yet. So I'm just gonna take me a little shower, and yeah. Then what else? Yeah, I'm still spotting. It's off and on now though, but so I still got my period panties on. But after I shower tonight, so tomorrow morning I'll just probably put on girl underwear and put on the pad, because I done went through a whole box of my period panties. So I do have another box, but I don't want to keep using all of them because my period's coming on in a few days. So all right, you guys, so it is the next day. It is Monday, June 9th, 2025, and it is 11:17 a.m. Oh my god, that hurts so bad. As you can tell, I'm sick, and I'm full on sick. So today I'll be focusing on getting rid of this cold versus treating my pain. So yeah, I took me a dose of Dayquil at 10 a.m. Then I took this little nasal spray, and I don't really care for that. Like, I feel like I'm high as I don't know what. I feel like I smoked like 8 joints. I don't like feeling like this at all. But yeah, I'm sick. I'm like, leave it up to me to get sick when I'm recovering from surgery. But I'm like, you know what, Lord? I woke up from surgery. That is something that is not something to be taken lightly. So I slept pretty good last night. I'm not in much pain, only when I cough. That's very painful. But I do have this little TwitchCon pillow, so hopefully I can just wrap that around my stomach when she's blowing her nose. When I cough. Ooh, y'all. This ain't no joke. But I slept pretty good. I'm about to go make me some breakfast. Sorry, y'all, my timer went off. I got up and I made me some black milk tea. So I'm about to go make me some breakfast. But yeah, I don't feel bad today. I was able to do my entire morning routine with no issues standing up. I'm still having like really bad hot flashes, but my cycle is due soon. So I'm like, I want to focus on getting rid of this cold. So I took me a Dayquil at 10 a.m. I want to take another one around like 4 or 5. Then take me a NyQuil around 11 p.m. and hopefully I feel better tomorrow, because right now it's this cough, which sucks when your stomach is killing you, or if you had surgery in your stomach. That's horrible. Then my nose is still stuffed up. I'm about to take my temperature and see if I have a fever. I don't think I do though, but I will still check. Yeah, that's just horrible. So I want to kind of get rid of the cold, especially before my cycle comes on, because then I want to take my regular Tylenol, you know what I'm saying? But other than that, like when it comes to the surgery, I don't feel bad. I am kind of like out of it, like I said, because I took this nasal decongestant and I just feel like I'm high. I don't really care for that, but I can breathe through my nose, so you gotta pick and choose. But I will try to update you guys later on today. What is today? What was it? 6, 7, 8, 9. Today's day 4 after my surgery. Yeah, I will try to update you guys later. Alright, you guys, so if y'all hear stuff in the background, my grandmom is in the shower. But today's date is Thursday, June 12th. It's currently like 11:05 p.m. But I have not recorded in a few days just because it was kind of the same thing. Like I was recording in the morning, recording at night, and you know, I was like, let me just give it a few days and then I'll come back and just kind of give you a big overview. So I'm going to give you all like my little notes that I wrote Then tomorrow, which will be Friday, which will be a week and a day post-op, I will show y'all my stomach, my incisions, and then I will end it off tomorrow. But as you can tell, I'm still sick. But yeah, so June 10th was day 5 after surgery. So I wrote still sick, so I took two doses of Dayquil and 1 of NyQuil. I wrote a lot of coughing, pain when coughing, and my stomach is 8 out of 10. It's still kind of bad. I wrote very tired this day despite almost 9 hours of sleep. I got like 8 hours and like 58 minutes of sleep, and I was so tired. This was on Wednesday. I was exhausted. Not Wednesday, this was Tuesday. June 10th was Tuesday. I was so tired. Getting up and sitting down started getting easier. Turning over in the bed got easier, and sitting up in the bed got easier too. The surgeon called and she talked about some pathology reports. I don't know what she was talking about. Like, when they start talking that doctor lingo, I don't know what they be talking about. So I was like, look, I'll see you at the post-op. And she said she was going to show me some pictures. So I'm going to try to, hopefully she gives me a copy, and I'm going to make a separate video kind of talking about the post-op and where we're going to go from where we are now. Then I wrote period started, yay. And I wrote rash under my breast and on my stomach started showing signs of healing. It was no longer red and itchy, so we're cool on that. But I really wasn't sure if my period had started until Wednesday. Then I was like, okay, my period started yesterday, because ever since my surgery, I've been spotting on and off. I'll have a few hours with no spotting at all. Then I'll go back to spotting. It was the light red bleeding, or it was the brown. So this is how it was until Tuesday. Then all day Tuesday, it was like almost like a day 4 of my cycle, where it's like just the red bleeding, but that's it. And it was consistent all day, but it really didn't come out on like the period panties. So I really wasn't sure, but it was a lot, like all day. So by Wednesday, it started coming out on my underwear and stuff, and I was like, okay, so it started yesterday because it was consistent all day. That's still my assumption. I don't really know. So now we're on Wednesday, June 11th, which is day 6 after my surgery. I wrote still sick, 130 ml dose of Dayquil and 1 less than 15 ml of Dayquil because I ran out. And then I took a 30 ml of NyQuil. And I wrote definitely on my period now. Bleeding is heavier. I wrote very, very, very bad hot flashes. Like, my hot flashes are so bad, y'all. Like, so bad. When I feel one coming on, I gotta turn the air on, and I gotta take this shirt off. I wish I could take my underwear off because I sweat so bad. Like, literally, after a hot flash, I could go like this on my back, and it's just dripping wet. And they are worse this time around than they have been every other period. But every period I have really bad hot flashes, and it's summertime. The high was 93 today, so. But yeah, they still are really. I had one in the bathroom not too long ago. They're horrible for some reason. So that's just what I've been having. Hold on. Oh my god, my belly button. So I started having period cramping, but they were like a 3 out of 10, a 4 out of 10. I was like, okay, is this how it's going to be after this laparoscopy? Then I'm not going to worry about it. Okay. So then I wrote stomach is very sore, and when the clothes touch my incisions, they feel strange. Like, I'm starting to feel my incisions and stuff more. Today is Thursday, June 12th, day 7 after surgery, so it's a week post-op. So I wrote extremely heavy bleeding. Every 30 minutes, I'm getting up, and when you on your period, this is for females, when you're on your period and the blood like fills up, I guess, in your little hole, and when you get up, it starts to like come out, so you walk like this because you don't want it to come out, and it gets all over everywhere down there. Yeah, that's how bad it is, y'all. Like, I'm saying, if I go to the bathroom at 10 o'clock, by 10:30, it's like that again. By 11, it's like that again. 11:30, it's like that again. I am bleeding extremely, extremely heavy. I'm feeling a pad every 2 hours. A full pad every 2 hours. Yeah. That's not normal. This is because of this surgery, I guess. 10 out of 10 cramping this morning. I'm walking back and forth. I'm rocking. 10 out of 10 cramping. The cramps are back to normal. They're not gone. So why I had the surgery, I don't know.
I took 3 doses of Tylenol, so it's 2 Tylenols extra strength 3 times today. So I kind of put the cold on the back burner because, yeah, these cramps are horrible. And I read a few articles. My surgeon told me nothing, but apparently your first 2 to 3 to even like 5 periods after a laparoscopy are horrible. They could be longer, heavier bleeding, and heavy cramping. So yay for me. I have about 2-3 more periods where I have to suffer like this. I'm still sick, and I was blowing my nose earlier. Nose started bleeding. Love that for me. Still bad hot flashes. I called my surgeon to see if I could wear a tampon because I had to go to I've been recovering from the surgery, and I was out all day yesterday, out all day today. You know, it's kind of annoying because I kind of want to stay home and just kind of recover, but it is what it is. Boom, that happened. So I can't, I called him to see if I could wear a tampon because it says until your surgeon says you can, but I can't until after my post-op visit, which is on the 23rd. So yeah, I'm filling a pad every 2 hours and I can't wear a tampon, and I had to go out. So I'm wearing period panties, and I put a pad on top of that. My pad was soaked. Anyway, surgery wise, bending has gotten a lot easier. The gas pain is almost all gone because I bent down earlier to pick up something and there was nothing. But then later on when I went to bend down, I felt it a little bit, but I'm like, okay, so the gas pain, honestly, I bought Gas X. It doesn't do anything. It's just like you just gotta let it, you know, with time. So it's about a week. It's almost all gone, and when I turn in bed, it doesn't really bother me anymore. I can't fully lay on my stomach yet because it's still like when I, you know, if I lay on it too much, then my decisions are like, and then I'm like, okay, then I move back off of it. But now I'm having period cramps and period symptoms, so I can't lay on my side anymore either. So it's life. And then my incisions are starting to peel off and itch. So that is the little update. This is gonna be a long video. I'm sorry for it in advance. Well, not in advance, but you know, I'm sorry. But I will pretty much talk to you guys tomorrow, and I will end this off, and then just look forward in July for a separate video about this whole journey and pretty much after my post-op. But I do want to show y'all my incisions tomorrow. My stomach is not as bloated anymore. That's how another reason how I can tell the gas is almost all gone. And then yeah, I'll end the vlog off tomorrow, and we Alright you guys, so it is now the next day. Again, it is Friday. So I already inserted 2 videos of my stomach. Right now it's a little bit bigger because I ate a little bit. Look at that. But yeah, my stomach bloats a lot. Y'all already know that. And that's actually a sign of endometriosis. They call it endo belly. So my stomach is just always bloated. Like I always look about 3 months pregnant, 4 months pregnant on my period. So but yeah, I'm still bleeding a whole bunch, so still can't put a tampon in. So it's like, you know, I'm putting on my period panties and then I'm putting on a pad because yeah, period panties are supposed to last a little bit longer than just like one wear, because as soon as I sit down, it's over with. So I put on the pad on top of that. Then yeah, like I literally just got back from the laundromat. I had like 5 pair of underwear because ever since my surgery, I've been wearing period panties. But yeah, so this is the little recovery video. There will be another video probably in July, kind of just doing like a recap, and then after I go to my post-op and everything she says. So yeah, I tried to be as honest and as transparent as I can be. Still sick as well. That's lovely. The cramps are not too bad today, but I still took me a pill. But at least I know tonight I'll probably take me a NyQuil so I can I'm trying to get rid of this cold, honestly. But yeah, that's pretty much all I have to say. I will see you guys in the next video. On one part of my sheet it says I can work out after a week. Then on another part of my sheet it says I shouldn't work out until I'm cleared by my doctor. So what should I do? Like, it's at this point, I'm going to start my cardio probably on the 15th, because that's just walking, and they want you to walk. And when I was at the laundromat and everything, I had no really like incision pain, bending down, no more gas pain. So I think we are good, y'all. But I'll just start doing my cardio workout on the 15th. And yeah, I just won't do my full body workout until after the 23rd. So thank you guys so much for watching. Please make sure you like, comment, and subscribe. Turn on the notification bell, know when I post, and share the video with your friends. Sorry for it being so long, but this is a week of recovery. And yeah, I will see you guys in my next video. Bye guys, love you.